before TissueCypher, the problem that we had was that endoscopy biopsy is a static picture of a dynamic situation. There's movement there, but unfortunately, you don't know what speed that patient is moving until you get the second picture at the second set of biopsies at the next endoscopy. And hopefully that patient hasn't fallen off the cliff by then. TissueCypher allows us to have almost like a video. So we know what patients are running for that fence that are at high risk, and we can intervene early, or the people that are low risk that are not going to get near the fence. So that's why I love this technology.
So, that's kind of where I utilize this testing, because there's these kind of unmet needs, and our guidelines don't completely fulfill all of these kind of different scenarios. The other thing is that it helps us prognosticate. It helps us kind of determine when to bring these patients back. We've all seen that one patient or a couple patients that progress within their interval endoscopy period. And how do we capture those patients?
So I think that that's the other unmet need, is how can we provide the information to patients in ways that they can understand it? How do we translate that into a conversation with them? How do we sit down and develop that trust with them? And then what are the additional tools and prognostication, including TissueCypher, that we can use to then make our recommendations and really be able to sit down with the patient and explain that. I think the other thing that's helpful about this is that if patient B opts not to proceed with ablation, then we do get better adherence to surveillance, because you can have those conversations. You know you have to shorten the interval, but in addition to that, you now have a little bit more to tell them about why do we need to do this and why is this so important for you in order to detect any early changes.
What I normally say is that these are all pieces in a puzzle, and we're using all these small pieces to figure out what I should do for you specifically and not for someone else.
We have all these guidelines that come out, but at the end of the day, if you look at that graph that we all know from the SEER database that has a over 700% increase in esophageal adenocarcinoma since 1970, we can't say that we're doing a good job. We have to do something different to change to make an inflection on that curve and to get it to decrease. Because we know where this cancer starts. We know what it looks like in a precancerous state. We have a good treatment, multiple good treatments to get rid of that precancerous lesion before it turns to cancer. And if we wait until it turns to cancer, it's deadly. So, we've got to do something to change that paradigm, and I think TissueCypher is a key tool for us to actually make some changes in this disease state.